thousands of residents of Nairobi continue to turn up to receive their first or second dose of the AstraZeneca vaccine in an outreach conducted by the NMACC and the Nairobi Metropolitan Services. Well, doses administered in Friday's outreach surpassed the doses issued cumulatively in the first outreach, indicative of a turnout that had more than doubled. Now, with more than 2 million doses administered so far, there is great importance in ensuring that the available shots end up in the arms of those who need them the most. Dorcas Wangira with more.
At high noon at the Karagita Mihango Stadium, Embakasi, Nairobi, Saturday, 75-year-old David Mwangi stills himself to make sure that his wife, 65-year-old Margaret Njambi, gets her first dose of the AstraZeneca COVID-19 vaccine. Margaret suffered a stroke and, being unable to walk, had not been able to get the vaccine, in spite of the fact that she is among the priority group of those aged above 58. It has cost them 1,000 shillings just to get to the stadium. Margaret moves with the aid of her walker, but it has become necessary to carry her to the registration tent, and then after to the tent where she finally gets her first jab.
Mimi nimeona ni mzuri nikuje sababu kuna mama mwingine alikuwa mgonjwa na alikufa. Mimi naweza kuambia wasiogope sababu hata si uchungu.
Her husband David received his first dose of the vaccine in April and the second in June, both times at the Pumwani hospital. He didn't want to leave his wife behind.
I don't want to leave her behind because I want her to be protected. Because if she gets infected and I've got protected, it's not good. I'm all right. Yes, I've got a high blood pressure, but still with it I can cope with my life.
Margaret is among thousands who showed up in the second mass vaccination outreach organized by the National Multi-Agency Command Center on COVID-19 NMACC and the Nairobi Metropolitan Service NMS from Friday 13th to Sunday 15th August in Ruaraka, Roysambu, Embakasi Central, Embakasi West, Makadara, Kasarani and Embakasi East. At the Makongeni River of Life Church, a low turnout was witnessed early morning, but it took the intervention of community health volunteers to mobilize more people to come out.
Most of the youths, when you go and give the information, some of them are saying that they're still young not to get the vaccine.
Nimeishi Nairobi miaka mingi, najua iko. Chenye umesikia serikali imesema iko.
By Friday, 8,574 doses were administered. This surpassed the 8,464 doses administered cumulatively in the first outreach.
It is possible to go door to door, but for the beginning, we are starting with this. The more we do the vaccinations, the cases should be able to go down. But also we should remember, we should also observe MOH protocols.
So far, 2,008,548 doses of the vaccine have been administered, with 1,264,362 being the first dose and 744,186 the second dose. The proportion of adults fully vaccinated is 2.7%. Those aged 58 and above account for the highest population of those vaccinated at 227,280. Others in the non-priority groups, 220,003, health workers at 126,097, teachers 109,944, and security officers 60,862.
But the most important question that must be asked is, are the right people, the people who need this vaccine the most, being reached? The elderly, those who are vulnerable, living with comorbidities, and those in the priority groups. Getting the vaccine does not mean that one will not get COVID-19. However, it is meant to prevent severe disease and death. But are the right people getting it? Dorcas Wangira, Citizen TV, Embakasi, Nairobi.